Diabetes does not always begin with a big and frightening symptom. Sometimes you simply start drinking water more often. You wake up at night to use the bathroom. After eating, you feel more tired than usual. And most of the time, you dismiss these things as stress, a busy schedule, or lack of sleep. I live in New York. Here, the day can sometimes pass very quickly. Morning coffee, subway, work, walking, a quick lunch. Then when you come home in the evening, that feeling of, why am I so exhausted today? On days like this, we can easily explain some signals coming from the body as busyness, lack of sleep, or stress. But if some symptoms appear again and again, it may be necessary to think about whether something related to blood sugar is going on in the background. In this video, we will look at diabetes not as a frightening label, but as an understandable topic related to the body's energy system. We will look at what diabetes is, which symptoms it may show, which signs should be taken more seriously, and what should not be exaggerated. First, let's make this clear. This video is not meant to diagnose you. It is meant to help you better understand some signals from your body, because hearing about a symptom and saying, "I definitely have diabetes," is not right. But constantly ignoring some repeated signs may not be a good idea either. Diabetes in its simplest form is a chronic condition related to the body not being able to manage glucose in your blood, meaning blood sugar, well enough. Glucose is one of the main sources of energy obtained from many foods we eat. Normally, the pancreas produces a hormone called insulin. Insulin can be thought of like a key that helps glucose move from the blood into the cells. So, what exactly is diabetes? The short answer is this. When the body cannot produce enough insulin, or when cells do not respond to insulin well enough, glucose may remain at higher levels in the blood. Over time, this condition can affect different systems, such as the heart, blood vessels, eyes, kidneys, and nerves. But the important point here is this. Although diabetes is often talked about as a single disease, it actually has different types. In type 1 diabetes, the immune system attacks the insulin-producing cells in the pancreas. This condition is usually related to insulin deficiency, and for many people, insulin treatment is vital. In type 2 diabetes, the body may not use insulin well enough. This is called insulin resistance. Over time, the pancreas may struggle to balance this burden. Type 2 diabetes can develop more slowly, and some people may not notice clear symptoms for a long time. Gestational diabetes is related to high blood sugar that appears during pregnancy. It may often cause no symptoms and is usually noticed through screening tests. In this video, we will mainly explain what diabetes means in the body and why the most commonly discussed symptoms may appear. The easiest way to understand diabetes is to think of it as an energy distribution problem. After eating, the digestive system turns some carbohydrates into glucose. Glucose enters the bloodstream. When blood sugar rises, the pancreas releases insulin. Insulin gives the cells the message, "Energy has arrived, you can open the door." But if there's not enough insulin, or if the cells no longer respond to insulin as well as before, glucose starts to remain in the blood. This can be thought of like a delivery truck waiting outside an apartment building, but the doors are not opening. The energy is there, but it cannot reach the cells properly. That is why some people may feel weak even after eating, because the issue is not only how much you eat, it is also how well the body carries that energy into the cells. When I first heard this, I found it very simple but explanatory, because in New York, on some days, even after eating a big sandwich at lunch, 2 hours later I could feel as if my battery had dropped. Of course, this alone does not mean diabetes. Sleep, stress, the content of the meal, caffeine, the amount of movement, all of these can have an effect, but blood sugar regulation is one of the important parts of this picture. The scientific uncertainty here is this: a single moment of tiredness does not tell us much, but tiredness that repeats often, is unexplained, and comes together with other symptoms should be evaluated more carefully. One of the symptoms most commonly associated with diabetes is frequent urination. This is often accompanied by an increased feeling of thirst. So why do excessive thirst and frequent urination appear together? Because when blood sugar rises, the kidneys may try to remove excess glucose from the blood. This process can lead to more fluid loss, and the body tries to compensate for this with the feeling of thirst. This may sound like a small thing, but it can be noticeable in daily life. For example, waking up often at night to use the bathroom when you normally do not wake up, starting to carry a water bottle in your bag all the time, or going to refill your water twice during the same meeting at the office. The thing to pay attention to here is not a single day. If you ate a very salty meal, walked in hot weather, or drank too much coffee, it may be normal to feel thirsty. But if this situation repeats for days or weeks, especially together with fatigue, blurred vision, or unexplained weight loss, it may make sense to consult a healthcare professional. Fatigue is also a common but very general symptom. That is why it is not a very strong signal on its own. We can all feel tired after a busy week, but in the context of diabetes, fatigue may be associated with problems in the body's process of turning glucose into energy. Why can blurred vision be connected to blood sugar? Changes in blood sugar levels can affect the fluid balance of the lens of the eye. This does not mean every blurred vision is diabetes, but recurring blurriness, especially if it comes with other symptoms, should not be ignored. In type 1 diabetes, symptoms may become noticeable within weeks in some people. Symptoms such as extreme thirst, frequent urination, unexplained weight loss, nausea, vomiting, or abdominal pain may appear more quickly. Especially in children and young people, these changes are sometimes described by families as "it happened suddenly." In type 2 diabetes, the picture may be quieter. Symptoms may develop slowly over the years. In fact, some people may have no clear symptoms. That is why type 2 diabetes is sometimes noticed during routine blood tests or another health checkup. This difference is very important because saying "I do not feel very bad" may not always mean that blood sugar regulation is completely normal. In the same way, intense symptoms that appear suddenly may point to a situation that needs to be evaluated more quickly. In daily life in New York, I think of it like this. Sometimes there is a small delay in the subway and no one notices it much, but sometimes there is a major failure in the system and the whole line stops. In some people, type 2 diabetes may progress like a slow system delay. In type 1 diabetes, in some cases, a more sudden and clear alarm may be seen. This comparison is not perfect, but it tells the viewer this: diabetes does not come at one single speed or with one single face. Some symptoms do not come to mind first when diabetes is mentioned, but they may be important. Let's say you got a small cut on your finger. Normally, you would expect it to heal within a few days, but this small wound takes longer than you expected. Then you notice that infections have also become a little more frequent in recent months. Maybe there's also a slight tingling in the feet. When looked at one by one, each of these may come from different causes, but if they appear together and repeatedly, the body may be telling us, "Look a little more carefully." Frequent infections may also draw attention, especially urinary tract infections, yeast infections, or skin infections may be seen more often in some people. The reason for this is that a high glucose environment may create suitable conditions for some microorganisms and may affect the balance of the immune system. Feelings such as numbness or tingling in the hands or feet may also be seen in nerve effects related to long-term high blood sugar. This is usually connected to longer processes and does not mean diabetes on its own. Dark, velvety skin areas around the neck, armpits, or groin may also be associated with insulin resistance in some people. This sign does not happen in everyone and may have different causes as well, but it is evaluated as one of the body's metabolic signals. When is it necessary to be more careful? The short answer: if symptoms repeat, cannot be explained, affect daily life, or if more than one symptom appears together, it is a good idea to talk about this with a doctor. The goal here is not to create panic, but it is also not to completely silence the small signals of the body. Scientific awareness stands exactly somewhere in between. There are many overly simple statements about diabetes, like if you eat too much sugar, you will definitely get diabetes. This sentence is too flat and misleading. The risk of type 2 diabetes can be shaped together with genetics, age, body composition, physical activity, eating patterns, sleep, some medications, pregnancy history, and other health conditions. Sugary drinks and excessive calorie eating may be associated with increased risk, but reducing diabetes to a single food is not right. Another wrong idea is this: diabetes only happens in overweight people. This is also not true. Weight and waist circumference may be important in type 2 diabetes risk, but diabetes can also be seen in people with normal weight. Type 1 diabetes, on the other hand, is related more to the immune system than to weight. The third misunderstanding is, if there are no symptoms, there is no problem. Especially in type 2 diabetes and prediabetes, there may be no symptoms. That is why it is important for people with risk factors to consult their doctors about screening. There is also a dark narrative, like, if you have diabetes, life is over. This is not healthy either. Diabetes is a serious condition, yes, but with monitoring, lifestyle adjustments, education, medications, and regular health checks, many people can maintain a good quality of life. The main message here should be awareness, not fear. In summary, let's remember 3 things. First, diabetes is related to a problem in the body's system of using glucose as energy. Insulin is at the center of this system. Second, frequent urination, increased thirst, unexplained fatigue, blurred vision, unintentional weight loss, slow healing wounds, and frequent infections are among the symptoms that can be associated with diabetes. But these symptoms may also have other causes. Third, diabetes does not always start loudly. Especially type 2 diabetes can progress silently. That is why knowing the symptoms and risk factors is important, not for panicking, but for being able to ask the right question at the right time. You do not need to be afraid of every small signal from your body, but you also should not be so busy that you cannot hear repeated signals. You can share this in the comments. Which health signal do you think is most easily overlooked in daily life? For scientific but understandable health content on Luvida, do not forget to like the video and subscribe to the channel.